Today we are going to talk about normal sinus rhythm. So, in normal sinus rhythm, the rate is always regular, which is in between 60 to 100 beats per minute. So, this is just a picture of normal sinus rhythm, just to give you an idea how it looks like in ECG. So, in this, P wave is always upright. It doesn't it will not be inverted. It will be always upright and preceded by QRS complex. The peer segment, it always remains constant. It doesn't get long or short. So these are just the normal characteristics of normal sinus rhythm. Okay, we will go more in detail. So here you can see the P wave. So when we get P wave in ECG, when there is a depolarization of atria, when atriums contract, we get P wave in ECG. And after that, there's a PR segment, which represents the time between atrial depolarization and ventricle depolarization. And here we can see the QRS complex, which is the depolarization of ventricles when ventricles contract. After that, there's the SG segment. What SG segment represents? It represents interval between depolarization and repolarization of ventricles. So when we get T wave in ECG, we get repolarization of ventricles. So when we get QRS, there's a depolarization of ventricles. Then when there's a T wave, there's a repolarization of ventricles. The time in between these QRS and T wave is called SG segment. Okay, so this is a PR interval which extends from P wave to QRS complex. And what is QT interval? It extends from Q wave, QRS complex to T wave. Okay, next. So, in our heart, there is a electrical conduction system. There's a SA node, which we call natural pacemaker of our heart. Then there's a AV node. So, when electrical impulse travels from SA node to AV node, we get P wave because it stimulates atriums to contract. When atriums contract, we get P wave in our ECG. So, the impulse when reaches to the AV node, it just get delays by 0.1 second. We get PR segment there. There's a pause between atrial depolarization to ventricle depolarization. We can say the time pause we call PR segment. Time in between atrial depolarization to ventricle depolarization. So, AV node sends electrical impulse to Purkinje fibers. So, it stimulates ventricles to contract. So, when ventricles contract, we get QRS wave in our ECG. Then there's SG segment, which represents we already discussed about this one, which represents interval between ventricle depolarization to ventricle repolarization. And there's a T wave which represents repolarization of ventricles. Okay, that's about it. Normal sinus rhythm. There are other rhythms like ventricle tachycardia, ventricle fibrillation, but to get to know them, firstly we need to understand normal sinus rhythm. Then we can identify what abnormal changes in the ECG. I hope it helped. Thank you for watching.